welcome back. In this lesson, we'll discuss a very important question. How do I choose my surgeon? This is a very serious topic. The surgeon's skill can literally mean the difference between life and death, so selecting the right surgeon is very important. And the first step is to create a list of candidates. You can ask your family or friends, your primary care physician, or any of your specialists if they have any recommendations. Once they provide you with few names, do your own research. Choose a surgeon who's board certified in general surgery and is fellowship trained in bariatric surgery. Many surgeons offer free informational session, which is an excellent way to meet and get to know your potential surgeon. Once you have done your basic research, schedule your initial consultation. And remember, your safety is at stake. So now is the time to collect your courage and ask all of your questions. So be sure to write your questions down ahead of time and take notes during your meeting. Write down their answers. And it's always a good idea to take a family member or a friend with you to the appointment. Having another set of eyes and ears to catch the things that you don't notice or forget is always a bonus. Here are a few questions you should ask. Are you board certified in general surgery? The answer should be an absolute yes. Are you fellowship trained in bariatric surgery? This should be another absolute yes. Now, an exception would be more senior surgeons who started doing bariatric surgery before fellowships were even invented. What percentage of your practice is bariatric surgery? I would say 50% is the least percentage to show their devotion. How long have you been doing bariatric surgery and how many surgeries have you performed? The more weight loss procedures your surgeon has performed, the safer you will be. Have any of your patients died within 30 days of surgery? If so, what were the circumstances? You should know some very experienced surgeons take on high-risk patients, which is sometimes accounts for death. Overall, the mortality rate for bariatric surgery is less than 0.5%. Do you do surgery in a minimally invasive fashion, meaning laparoscopically or robotically? The short answer is as long as your surgery is minimally invasive, then you're in good hands. The experts are still debating on which is safer, laparoscopic or robotic surgery. I have extensive experience with both, so I discuss with each patient which technique is better for them individually. But in general, offering only one technique based on your surgeon's experience is absolutely okay. Let's keep going. What different types of weight loss surgery do you do and what are your opinions of them? Your surgeon should at least have extensive experience with sleeve gastrectomy and gastric bypass. If your surgeon only offers one type of surgery for everyone, then it's time to find another surgeon. There is no one size fits all when it comes to bariatric surgery. Again, don't forget to ask how many sleeves and bypasses have you done. In the end, the most important thing to consider is the personal connection. You need a surgeon with whom you feel comfortable and can establish a personal connection. Bariatric surgery is a major decision and you want to feel confident and supported throughout the process. In summary, choose a surgeon who's board certified in general surgery and fellowship trained in bariatric surgery. You also want to select a surgeon who's devoted to bariatric surgery and has experience with at least sleeve gastrectomy and gastric bypass and has done many of both procedures. Most importantly, choose a surgeon who's approachable, listens to your concerns, and clearly explains the procedure. Once you choose your surgeon, the next step is to reach out to your insurance company to make sure they will cover the surgery for you. If your insurance doesn't cover bariatric surgery, then you may choose to pay for the surgery out of pocket. If you must go that route, many practices will help you finance the surgery, and some will have an arrangement with a private insurance company which provides you with insurance to cover any complication following the surgery. Regardless of how you pay for your surgery, the expenses may be tax deductible. However, make sure you consult an accountant before claiming any deduction. Okay, I know this was too much information. Take a break and I will meet you in the following video.